everyone, my name is Bree. I did my project on Germany's healthcare system. There are 4 main principles. Everyone must have insurance. Funding for insurance premiums is through tax revenue, and the principle of solidarity, which basically says that everyone has equal right to medical care and continued payment of wages when they're ill. And then the principle of self-governance, which basically says that even though the German state is an overseeing body, that there are federal committees within the government, and those committees are self-governing bodies, and they're made up of different organizations that send out the financing. The organizations are through the Federal Joint Committee, and they're made up of physicians, insurers, and insurees. There are 2 main types of insurance through the universal health insurance system. There is the statutory health insurance. This is available to everyone. It makes up about 3/4 of the population. And then there's the private health insurance. Private health insurance is something that is available to anybody whose income is over the threshold, which is about 70,000 euros. And then that basically both the SHI and the PHI cover preventative care, outpatient, inpatient, mental health, eye and dental, and sick leave. There are 3 areas of care. The inpatient care, which is anything that's an overnight stay, and the hospitals associated with this, most of them are financed through the state or sometimes through nonprofit charity and religious groups. Most hospitals take the SHI insurance. Some of the smaller for-profit hospitals will take the PHI. These are meant for more specialized care. And then there are outpatient services, and those are provided by self-employed physicians. And usually those physicians are your family doctor and specialist. The family doctor is who you see when you're ill, and they can send you to the specialist. There are certain illnesses where you're allowed to go straight to a specialist. And it's important to note that they're actually allowed to choose whichever doctor they go to. So through their family doctor, they can choose any doctor since it's all through one insurance plan. And when they go to the specialists, you can choose any specialist you want once you're referred to them. And then there are the rehabilitation centers. So there are 2 main categories there. There's the rehabilitation that covers like physiotherapy, psychological therapy, after surgery, accidents, that kind of thing. And then there's rehabilitation that covers mental illness and addiction. Okay, the role of government. The Federal Ministry of Health is the overseeing entity, and they are responsible for all policy making. And then the Federal Joint Committee, that I discussed a little bit earlier. It's made up of several different entities, organizations like through physicians, insurers, insurees. And those committees come together and they have the highest decision-making abilities. And they are also responsible through them and then subcommittees for quality assurance. And through the quality assurance, they also have research methods. So any or research organizations, so any of those different committees, they do the research and they give that information to the Joint Committee, who then is able to use that as their reasons for different kinds of funding and policy making that they send to the Federal Ministry of Health. Okay, funding and cost sharing. Premiums are collected through tax revenue. The tax revenue is made up of both employee and employers, and they both pay a percentage into the fund. And then what the employees are paying, they pay 2% of their income towards it, and it is capped. There's a certain amount where once you make that amount, everything over that is no longer included in the insurance. The cap is, I found some different numbers in there, but the cap was somewhere around $70,000 US. And then if you are chronically ill, you actually only have to pay 1% of your income towards that tax. And then for that cost sharing, that anybody who's under 18 is not included. So Anybody who's an employed individual, any of their dependents, if they were working, they wouldn't have to pay into that. And then there are some copays, not a lot. They've changed that policy over the last several years, last decade or two. And currently they are charging copays. They're very minimal, mostly for prescriptions or hospital stays. So all those funds are collected, and then they're by the organization or the committee, and they are then dispersed to the different nonprofit entities through the SHI. And then another thing they are now doing is long-term care. Is now a required insurance. Long-term care is additional cost, and it is available through SHI and PHI programs. Okay, and then these are my references. Thank you very much.